Hello, and welcome to the CDPHE Continuity of Operations, or COOP training. Before you think emergencies won't happen and the information in this video probably won't ever apply to me, ask yourself this question. In 2019, did you think the COVID-19 pandemic would change as much as it did for 2020 and beyond? So what is continuity of operations and why are we learning about it? Well, let's ask some members of the CDPHE's Office of Emergency Preparedness and Response, or OEPR.
Continuity of operations is defined by the Federal Emergency Management Agency, commonly referred to as FEMA, as an effort within individual organizations to ensure that essential functions continue to be performed during disruption of normal operations. Furthermore, this definition expands to include the ability to provide uninterrupted services and support while maintaining organizational viability before, during, and after an incident that disrupts normal operations. One of the state's principal departments, the CDPHE, not only has a duty to ensure our department's continuity of services to the public, we're also required to do so by law. At CDPHE, we maintain a continuity of operations plan that follows the continuity planning guidance provided by the Federal Emergency Management Agency and other federal publications and standards. As such, it is vitally important that all CDPHE employees have a general understanding of continuity of operations, so when emergency situations occur which warrant a continuity activation, you have a better understanding of what this means. Continuity of operations is broken down into 3 overarching components with 11 key elements that flow through 4 phases. Let's first examine the 3 overarching components, which are enduring constitutional government, continuity of government, and continuity of operations. Together, these 3 components form the core concept of continuity of operations, and each component is built on the other 2. At the highest level is enduring constitutional government, which is the cooperative effort among the executive, legislative, and judicial branches to preserve the constitutional framework under which people are governed. Next is continuity of government, which is an outcome of continuity of operations and ensures that elected and appointed officials at all levels of government across the United States and its territories can still perform their required tasks. Finally, there is continuity of operations, which is truly where the 11 key elements come into play as they collectively form the core of the planning and operational process. These 11 elements are program management plans and procedures, essential functions, orders of succession, delegation of authority, communications and information systems, essential records management, alternate locations, human resources, devolution, reconstitution, and finally, testing, training, and exercising.
So we've learned about the 3 components and how collectively they form the overarching concept of continuity. Indeed, at the most basic level, continuity of operations is all about keeping our institutions and government functioning. But how do the 11 key elements work? How do they relate to CDPHE? How are they operationalized? Let's talk to some subject matter experts within the department to find out more information about each one.
Program management plans and procedures is really that first vital step in the continuity process for the department. In this process, emergency preparedness planners work to maintain CDPHE's COOP plan by ensuring it is updated, adheres to all applicable laws and regulations, develops internal policies with leadership, coordinates with all applicable stakeholders, develops memorandums of understanding or mutual aid agreements, and coordinates various other administrative functions necessary to ensure the viability of the plans as a whole.
Essential functions are a subset of organizational functions that are determined to be critical activities. Typically, government agencies identify essential functions and critical services necessary to accomplish the overarching mission of the agency. There are a host of factors which contribute to determining what functions are essential and those which are not. These factors include, but are not necessarily limited to, laws, regulations, contracts, fiscal requirements, and whether or not the function has impacts to life safety, property protection, environmental protection, and economic stability. A distinction should be made between essential and important functions. There are many important functions that can be deferred until after an emergency situation. But just because some functions are not identified as essential does not mean that those functions are considered unimportant. In many cases, legally mandated functions will be essential.
Orders of succession are the formal sequential listings of positions, rather than specific names of individuals, that identify who is authorized to assume a particular leadership or management role when the incumbent is unable to perform the functions and duties of their position. Most governmental agencies have a hierarchical structure, and orders of succession follow a top-to-bottom sequence.
Delegations of authority ensure the orderly and predetermined transition of responsibilities within an organization and are related to, but distinct from, orders of succession. A written delegation of authority provides the recipients with the legal authorization to act on behalf of the organization head or other officials for specified purposes and to carry out specific duties. Delegations of authority usually state what powers and authorities can be executed and under what circumstances they can be performed. Furthermore, delegations of authority usually have time limits and are not intended to last indefinitely, but rather to be used in the interim until positions are filled and the chain of command is restored to normal conditions.
Communications and information systems is the ability to communicate with agency personnel and stakeholders across all sectors, which is vital during all continuity phases. Having access to all necessary communication systems and ensuring they are working correctly is at the core of this key element. Depending on the nature and magnitude of the emergency, communication systems may be interrupted, experience delays, or fail to function properly. It is also possible to see a rise in cybersecurity issues, such as hacking attempts, email phishing, etc. Therefore, it is vital to continuously monitor networks and ensure that all security protocols and redundancy systems are adequate and operating correctly. Essential records management is the collective data, contracts, fiscal records, legal documents, and any other information that is vital to performing essential functions. Essential records should always be backed up on secure servers and have multiple lines of redundancy in case primary systems are inaccessible or become inoperative. Furthermore, data backup and restoration of electronic information is vital and should be done jointly and coordinated with both the overall continuity plan and the ITDR plan. It is also important that laws and regulations regarding essential records should be adhered to, and in the case of CDPHE, laws such as the Colorado Open Record Act, CORA, the Health Insurance Portability and Accountability Act, HIPAA, and the Colorado Information Security Policies, CISPs, may be of particular importance, especially in regards to protected information.
Alternate locations are pre-identified locations that may be fixed, mobile, or transportable and serve as interim locations where essential functions can be performed until a new permanent facility can be acquired or the original facility can be reoccupied. Depending on the situation, the personal homes of agency employees may serve as alternate locations as department-wide teleworking can be implemented. Furthermore, MOUs or MAAs, fiscal contracts, lease agreements, insurance policies, contact lists, and other necessary agreements should be regularly maintained and on file regarding alternate locations. Additionally, alternate location sites and their communication methods should be regularly drilled to ensure a consistent level of readiness.
Human Resources performs a critical role throughout all 4 cycles of continuity of operations. Human Resources identify individuals within the department who perform essential functions and, if necessary, identify secondary individuals for position redundancy should the primary individuals be unavailable to perform their duties. Human Resources determines what positions must be performed on-site or if they can work at alternate facilities, telework, or utilize a hybrid model depending on the scope and nature of the work. Moreover, Human Resources is instrumental in creating or amending workplace policies as conditions and operational needs change. During an emergency, staffing levels may experience mild to extreme fluctuations, and Human Resources may experience a surge of employee onboarding or offboarding depending on operational needs of the department. In all, Human Resources will play a significant role in emergencies, and the work done by HR will have department-wide effects.
Devolution is defined as the ability to transfer statutory authority and responsibility from an organization's primary operating staff and facilities to other designated staff and alternate locations to sustain essential functions. Divisions within CDPHE should regularly consider if devolution is a realistic and possible strategy given the nature of their work. When considering devolution, there are multiple factors which must be accounted for, such as laws, regulations, licensing, insurance, contracts, financial policies, and liability. Active and passive triggers address how, when, and for how long a transfer of essential functions will occur, detailed instructions of how to properly perform the essential functions, a list of necessary resources such as personnel, services, equipment, and materials to facilitate the performance of essential functions, a contact list of all stakeholders, partners, and subject matter experts pertinent to the essential functions, and any other essential information necessary to perform the essential functions. Since devolution planning is so complex, be sure to include all partners and stakeholders in the development process and review them regularly. If significant changes occur in the way essential functions are performed, they must be well documented in the devolution plan and shared in a timely manner with all pertinent stakeholders and partners. Reconstitution is the fourth phase in the continuity of operations cycle, and in the most simplistic of terms, is the return to normal operations and recovery. Reconstitution occurs on a spectrum with many variables and can range from simple to incredibly complex. Reconstitution is best performed in a gradual manner as normal systems are brought back online methodically. This also helps to ease the transition of staff back into normal routines or into new routines that may have been developed during or shortly thereafter the emergency. Reconstitution activities can vary widely, but some of the common activities can include assessing the status of affected facilities, assessing the status of personnel post-emergency, verifying all critical systems are restored and functioning properly, resuming non-essential functions, and monitoring all systems as they are incrementally brought back online, making corrections as needed.
Testing, training, and exercising involves providing education for staff and conducting exercises that are designed to test and validate our planning efforts. Testing and exercising our plans provides us with the opportunity to see if our plans and policies will actually work and how we can improve them based on after-action reports and improvement plans. Testing, training, and exercising should be conducted on a regular basis to maintain proficiency, and drills or exercises should be based on a variety of scenarios that specifically exercise different components and systems.
As previously mentioned, continuity of operations flow through a series of 4 phases, which are readiness and preparedness, activation, operations, and reconstitution. The readiness and preparedness phase is where all administrative functions of COOP occur, which include planning, training, exercising, and incorporating COOP elements into day-to-day operations. The activation phase occurs either during or right after an incident. In this phase, communication is vital, and the primary activities are assessing the needs of the situation, agency leadership coordination, notifying staff, and prioritizing agency activities, and determining what, if any, essential functions are or will be impacted by the event. The third phase is operations, and in this phase, personnel begin to implement the strategies in the plan to ensure mission essential functions are being performed, or if they are disrupted, begin the process of restoring them as soon as possible, or within recovery time objective. Depending on the incident, certain operations may be temporarily suspended. Staff may be working in alternate locations or teleworking, and roles and positions may change. Furthermore, workplace policies may be amended, suspended, or brand new ones will have to be created to either replace or augment the existing policies. Lastly, phase 4 is reconstitution, and in this phase, operations are returned to normal, typically in gradual segments to ensure sustainability and to make the process as smooth as possible. Reconstitution is more than just returning operations to normal. It's an opportunity to reflect, to understand how events in the operations phase occurred, and make lasting improvements to the betterment of the agency and its stakeholders.
So now that we've learned about COOP, ask yourself the following question. What is an organization but the people who compose it? No matter how well written our plans are, no matter how much training has been done, without people, there simply is not an organization.
Therefore, the personal preparedness of CDPHE's staff members is the foundation for all our collective preparedness efforts throughout the department. So here are some great resources that can help you and your loved ones take steps to better prepare for emergencies. As always, if you need any assistance or have any questions, please reach out to the Office of Emergency Preparedness and Response, or HR.
Well, that covers everything for now. We hope this video provided useful information not only about the department's COOP planning efforts, but also for your personal preparedness. While we hope to not have to use our emergency plans, it's important to remember that when it comes to emergencies, it's not a question of if, but rather when. So, stay safe and be prepared. Thank you so much for your time and attention.